In the dead of night, when the world hushes into silence, the heart races as if running a marathon unfelt and unseen in the light of day. This is the reality for those who experience anxiety attacks, a tumultuous storm brewing within, invisible to the eye but overwhelmingly palpable in its effects. These episodes, characterized by intense fear and a cascade of physical symptoms, can make ordinary life seem like an insurmountable challenge. Yet, it is in understanding and mastering these storms that one can find calm and regain control. Anxiety attacks strike without warning, sending shockwaves through the body and mind. These episodes, often marked by a rapid heartbeat, shortness of breath, and an overwhelming sense of dread, can disrupt daily life and well-being. Understanding the nature of these attacks is the first step towards mastering them. The symptoms are both physical and psychological, ranging from sweating and trembling to feelings of detachment or impending doom. Recognizing these signs early on is crucial in managing them effectively. Each symptom is a note in the distressing symphony of anxiety, and understanding their onset can help orchestrate a calmer response. Physiologically, anxiety attacks are a hyperarousal of the body's fight or flight response, a primitive mechanism that heightens our senses and readiness for perceived threats. In the modern world where physical threats are rarer, this response can be triggered by stressors that are psychological rather than physical. Understanding this can demystify the experiences during an anxiety attack and pave the way for effective coping strategies. Anxiety attacks are not arbitrary. They often have identifiable triggers that can vary widely from one person to another. Common triggers include stress, traumatic events, and specific phobias such as fear of flying or heights. Understanding these triggers is a pivotal step in managing anxiety attacks. Underlying mental health conditions also play a significant role. Disorders such as generalized anxiety disorder, GAD, or panic disorder can predispose individuals to frequent and intense anxiety attacks. These conditions can amplify everyday stresses, making them seem insurmountable and thus triggering an attack. By identifying personal triggers, individuals can begin to implement strategies that address these specific issues. Awareness of these triggers allows for a proactive approach to managing anxiety rather than a reactive one, helping individuals maintain control over their responses. The science of anxiety is rooted in our biology, specifically in how our brain perceives and responds to threats. During an anxiety attack, the amygdala, a part of the brain that deals with emotional processing, signals a threat, triggering a cascade of biochemical reactions designed to protect us. This reaction includes the release of adrenaline and cortisol, hormones that prepare the body for a quick response. Physically, this can lead to an increased heart rate, heightened senses, and quicker reflexes, useful for immediate physical action, but often overwhelming when the threat is psychological. Understanding this biological groundwork not only demystifies the sensations experienced during an anxiety attack, but also empowers individuals to recognize these responses as natural, albeit sometimes inaccurately triggered processes. This knowledge is essential for applying physiological techniques to counteract these reactions effectively. Breathing techniques are among the most immediate tools for managing anxiety attacks. By controlling breath, one can directly influence the autonomic nervous system, which calms the body's fight or flight response. One effective method is deep breathing, also known as diaphragmatic breathing. This involves taking slow, deep breaths through the nose, allowing the belly to rise, and then slowly exhaling through the mouth. This type of breathing promotes a full oxygen exchange and can help reduce the heart rate and blood pressure, mitigating some of the most uncomfortable symptoms of an anxiety attack. The science behind these effects lies in the vagus nerve, which, when stimulated through deep breathing, activates the body's relaxation response. Practicing these techniques regularly can not only provide immediate relief during attacks, but can also decrease overall anxiety levels over time. Progressive muscle relaxation, or PMR, is a technique designed to reduce anxiety by sequentially tensing and then relaxing different muscle groups throughout the body. This practice promotes awareness of physical sensations and can help break the cycle of physical tension that often accompanies anxiety. To perform PMR, one might start by tensing the muscles in their feet and holding that tension for a few seconds before releasing it. This process is then repeated, moving progressively up through the different muscle groups in the body, calves, thighs, abdomen, and so forth. The benefits of PMR in anxiety management are twofold. Physically, it helps alleviate symptoms like muscle tension and trembling. Psychologically, it fosters a greater sense of control over one's body, which can be particularly empowering during an anxiety attack. Regular practice can make it an effective preventative tool as well. Mindfulness meditation is a mental training practice that teaches one to slow down racing thoughts, let go of negativity, and calm both the mind and body. Techniques generally involve breathing methods, guided imagery, and other practices to relax the body and mind and reduce stress. This practice hinges on the principle of presence. By focusing intently on the present moment, often through a focus on breath or body sensations, mindfulness meditation can decrease the propensity to react stressfully to thoughts of past or future events, common triggers for anxiety. Scientific studies have shown that mindfulness meditation can reduce the gray matter density in the amygdala, known for its role in stress processing in the brain. This alteration not only helps in managing immediate symptoms, but also contributes to long-term anxiety reduction. Grounding techniques are practical tools designed to redirect attention from anxiety to what is physically happening in the environment. These methods can be particularly useful during an anxiety attack as they help bring an individual back to the present moment, distancing them from overwhelming feelings or panic. One simple grounding technique is the 5-4-3-2-1 method, which involves identifying 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This exercise helps focus the senses and can provide a distraction from distressing symptoms. Another technique involves tactile sensations, such as holding onto a piece of ice. The shock of the cold can help pull a person's mind away from panic and back to reality. These techniques can be powerful in providing immediate relief and can be practiced anywhere, making them highly accessible tools in managing anxiety attacks. Cognitive behavioral therapy, or CBT, is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including anxiety attacks. CBT focuses on changing negative patterns of thought and behavior that contribute to one's difficulties, and it often involves efforts to change thinking patterns. This therapy teaches individuals to recognize and reevaluate their fears, challenge the underlying assumptions that lead to anxiety, and replace them with more realistic and effective thoughts. Techniques such as exposure therapy, where patients gradually encounter their source of fear under controlled conditions, are also commonly used. CBT has been extensively researched and is considered a gold standard in the psychotherapeutic treatment of anxiety disorders. It empowers individuals to take control over their anxiety rather than being controlled by it, providing tools that are useful in everyday situations beyond the therapy sessions. While therapy and coping techniques are crucial, medication can also play a vital role in managing anxiety. Common medications used include selective serotonin reuptake inhibitors, or SSRIs, and benzodiazepines. SSRIs help increase the level of serotonin in the brain, which can regulate mood, while benzodiazepines work by calming the nervous system. However, it's important to consider the potential drawbacks. Medications can have side effects, and in cases like benzodiazepines, there is a risk of dependency. It is crucial to discuss these options with a healthcare provider to ensure that the benefits outweigh the risks. The decision to use medication should be made with careful consideration, and typically in conjunction with other treatments like therapy. For many, the right combination of medication and therapy can be life-changing. offering relief that allows them to function more effectively and with less distress. Beyond immediate coping strategies, long-term management of anxiety often involves lifestyle adjustments. Regular physical activity can significantly reduce symptoms, as exercise releases chemicals like endorphins and serotonin that improve mood and decrease stress. A balanced diet is also crucial. Foods that can exacerbate anxiety include those high in refined sugars and caffeine, which can increase nervous energy. Conversely, a diet rich in vegetables, fruits, lean proteins, and whole grains can have a stabilizing effect on mood. Sleep is another critical factor. Anxiety can often disrupt sleep, creating a vicious cycle. Establishing a soothing bedtime routine and aiming for 7 to 9 hours of sleep can help break this cycle and reduce anxiety levels. These lifestyle changes, while sometimes challenging to implement, can provide significant long-term relief. Having a robust support system can be a tremendous asset in managing anxiety. Being able to talk openly about one's feelings can alleviate the isolation that often accompanies anxiety disorders. Friends and family can provide a non-judgmental space to share struggles and accomplishments. Additionally, support groups, whether online or in person, can offer valuable opportunities to connect with others facing similar challenges. These groups provide a forum for exchanging personal experiences and coping strategies, contributing to a sense of community and understanding. The encouragement and understanding from a support system can boost one's motivation to continue managing their anxiety and remind them that they are not alone in their struggles. This social support is crucial for long-term mental health maintenance and resilience. Knowing when to seek professional help is key to effectively managing anxiety. If anxiety attacks become frequent, or so severe that they significantly impact work, relationships, or daily activities, it may be time to consult a mental health professional. Therapists can provide a diagnosis and personalized treatment plan that may include therapy, medication, or a combination of both. Counseling sessions can also offer new insights into what triggers anxiety and how to cope with it effectively. The process of seeking help can be daunting, but it's a critical step towards recovery. Mental health professionals can provide the expertise and support necessary to navigate the complexities of anxiety disorders, offering strategies and support that go beyond what friends and family can provide. Hearing from others who have faced and managed their anxiety can be incredibly inspiring. Personal stories often highlight the diversity of anxiety experiences and the various strategies individuals employ to cope with their symptoms. One such story might involve someone who overcame severe panic attacks through a combination of mindfulness, cognitive behavioral therapy, and medication. Another might describe how adopting a pet provided daily support and motivation, easing feelings of isolation and anxiety. These stories not only provide real-life context to the struggles associated with anxiety, but also demonstrate that recovery is possible. They serve as a reminder that with the right tools and support, anyone can regain control over their anxiety and lead a fulfilling life. Recognizing personal triggers is a crucial aspect of managing anxiety. It involves self-reflection and possibly maintaining a diary to record instances of anxiety attacks and their possible triggers. Over time, patterns may emerge that can offer insights into what situations or thoughts trigger anxiety. Once triggers are identified, strategies can be developed to manage them. This might involve avoiding certain triggers when possible, or preparing coping strategies for unavoidable situations. For example, if public speaking triggers anxiety, one might prepare by practicing extensively or using calming techniques before and during the event. Managing triggers is not about avoiding all stress, but about understanding and mitigating it in a way that maintains one's quality of life. It's an ongoing process that adapts as an individual's circumstances and reactions evolve. Resilience against anxiety isn't typically inherent but developed over time through consistent practice and commitment to self-care. Building resilience involves fostering a positive mindset, maintaining physical health, and regularly practicing coping strategies. Activities like yoga, meditation, and journaling can enhance resilience by improving one's ability to cope with stress. Additionally, setting realistic goals and celebrating small victories can strengthen the belief in one's ability to manage anxiety. As resilience builds, the intensity and frequency of anxiety attacks can decrease. This doesn't mean that anxiety disappears, but rather that it becomes more manageable and less disruptive to daily life. Resilience offers a buffer against the challenges posed by anxiety, providing a stronger foundation from which to approach life's stresses. Anxiety doesn't only affect adults. Children and adolescents can also experience intense anxiety attacks. The manifestations in young people can be different, often mistaken for behavioral issues or moodiness. Recognizing anxiety in young people is crucial, as early intervention can prevent long-term issues. Strategies for managing anxiety in younger individuals often involve a combination of therapy, such as play therapy or CBT, and support from parents or guardians. Educating parents on the signs of anxiety and effective communication techniques can also make a substantial difference. Schools can play a supportive role by providing an understanding environment and necessary accommodations. Recognizing and addressing anxiety in young people is essential for their overall development and well-being. While technology has many benefits, it can also be a double-edged sword when it comes to anxiety. Constant connectivity can lead to information overload, heightened stress, and disrupted sleep, all of which can exacerbate anxiety symptoms. However, technology can also be a powerful tool in managing anxiety. There are numerous apps designed to help with meditation, mindfulness, and stress management. Online therapy options also make it easier for individuals to seek help when they need it. Balancing technology use is key. Being mindful of when it begins to contribute to stress and taking steps to mitigate its negative impacts. Setting boundaries around technology use, particularly before bedtime, can help minimize its anxiety-inducing effects. Research into anxiety is continually evolving, with new therapies and insights emerging regularly. Current trends include the exploration of genetic factors that contribute to anxiety and the development of personalized medicine approaches to treatment. Emerging therapies like virtual reality exposure therapy are being studied for their potential in treating phobias and anxiety disorders. Additionally, the role of gut health in mental health is a growing area of research, reflecting a more holistic approach to treating anxiety. Staying informed about these developments can provide hope and additional options for individuals struggling with anxiety, pointing towards a future where anxiety is even more manageable and understood than it is today. In conclusion, while anxiety attacks can be daunting, they are also manageable with the right strategies and support. Understanding the nature of anxiety, recognizing personal triggers, and employing techniques like deep breathing, mindfulness, and CBT can provide significant relief. Remember, managing anxiety is not about eliminating it completely, but learning to live with it more comfortably and preventing it from controlling your life. Patience, persistence, and self-compassion are key. Thank you for joining me in this exploration of anxiety management techniques. If you found this information helpful, please like this video and subscribe for more insightful content. Together, we can take steps toward a calmer, more empowered life in the face of anxiety.